unfortunately, unexplained infertility is probably one of the largest causes, but that's really after we've excluded male causes and the female causes. And it's basically a third is really the causes of infertility. So female infertility is basically lumped, I suppose, into ovulatory disorders, and a further video discusses PCOS at length. So other ovulation causes are perhaps the woman being potentially underweight, overexercising, or for some other reason having some central suppression of the drive on the ovaries. So that is called hypothalamic amenorrhea, or a hypothalamic cause of irregular ovulation. Generally, lifestyle advice, simple advice can assist, but if not, we will proceed into some ovulation induction strategies, and again, that is something at Fertility Specialists we have published in the world literature on, and we are very effective and successful in managing that. Unfortunately, the other cause of ovarian infertility relates to an ovary which unfortunately is heading towards the menopause. So more commonly, this is associated with age-related decline of reproductive function. But however, unfortunately, some young women, for no reason that is apparently evident to them, will be at risk of premature ovarian insufficiency. So it may well be that there's a family history of an earlier menopause, and perhaps granny and mum had their children when they were younger, and it wasn't really evident, and therefore the woman's at risk of this. But occasionally this can be due to perhaps such as ovarian surgery the woman has had, or severe endometriosis, or potentially some underlying genetic disorder. So that is one of the most challenging causes, premature ovarian insufficiency. So that is ovarian causes. It probably leads nicely on to talking about a major cause of infertility, which is endometriosis. Now, endometriosis is an inflammatory condition of the woman's pelvis, effectively where the lining of the womb has translocated out of the fallopian tubes and implanted in the pelvis. It can create inflammation and scarring, and in many instances the woman is completely unaware of this. And I don't want to convey the message that all women with endometriosis are going to struggle with getting pregnant. In fact, many women will go to their grave, have a completely normal life, have a completely normal family, and we're unaware of it. However, it's not to underestimate that, in fact, for many women, it does cause significant menstrual disturbance, pelvic pain, and for some, infertility. So the management of that can be basically medical and surgical. In good surgical hands, surgical treatment may improve infertility. Medicine, unfortunately, generally stops the woman ovulating, which obviously is counterintuitive in a woman trying to get pregnant. So medical management has very limited place in infertility. So how will we get her pregnant if she's had surgery that's been unsuccessful and not getting her pregnant? It's generally, due to the scarring, it causes anatomy disturbance within the pelvis, so she probably will need to proceed down an IVF route. So IVF often has its place in a woman with endometriosis. And I suppose that leads nicely into probably the next major cause. It's probably fallopian tube damage. And unfortunately, sexually transmitted disease is quite common in our population. And many instances that may be unrecognized. For many women, there may be long-standing inflammation that's been there for many, many years, which causes insidious damage with time. So she may be unaware of this. However, it could be related to something such as a grumbling appendix that a woman had when she was a child, for instance, because a grumbling appendix may release a bit of inflammatory tissues, like pus is probably the colloquial term, into the pelvis, creating inflammation and scarring. So she may present several years later with damage to the fallopian tubes, which may not be obvious to her. She may have no symptoms, but it only transpires when we do some tests. So that's how IVF really started, was to deal and overcome fallopian tube damage. So IVF is fantastic in that situation. Probably another cause of infertility is more structural, is perhaps things like fibroids. So fibroids are perhaps an instance where surgery sometimes can massively improve a woman's chance of getting pregnant. She may present with heavy periods, pelvic pressure and discomfort, but in many instances surgery may substantially alleviate her symptoms and help her conceive. So effectively, they're the causes of female factor infertility relating to the ovary, perhaps due to damage to the fallopian tubes, this inflammatory condition of endometriosis, and maybe some structural problem with the pelvis. And often the treatment may well be related to helping her ovulate or proceeding on to IVF.